the Bald Oncologist podcast series, featuring Dr. Malwinder.
Okay, so in the studio today, we have Yoon Sook Yee. She's a genetic counselor. So we'll be discussing about genetic testing in breast cancer patients. So Sook Yee, tell me a little bit about yourself.
Good afternoon.
Good afternoon.
Thank you for having me here today. I'm a certified genetic counselor and I work with Cancer Research Malaysia primarily, but I'm also a visiting genetic counselor in UMC and some of the practice hospitals here.
Okay, so before we start, I think a couple of years back, there was something in the news about Angelina Jolie where she went for the breast surgery and she went for oophorectomy to remove her ovary because it took the world by storm. Something about BRCA was coming into the picture. Can you tell me a little bit about BRCA? What is BRCA and what's the prevalence in the nation?
Yes, she did take the information news by storm. So what happened was that we all know Angelina Jolie is a beautiful actress. Mm-hmm. So she wrote a piece in the New York Times in the editorial, and she talked about how she had her breast and her ovaries removed because she was at high risk of breast cancer and ovarian cancer. She's well. She did not have any cancer. And, it comes as a surprise to everybody because, why would a beautiful actress do that? Mm-hmm. And she explained in the piece about BRCA or BRCA, sometimes it is known, and because she had some changes in those genes that put her at a high inherited risk for these cancers. So a little bit about these two genes, BRCA1 and BRCA2. Sometimes we call it BRCA1 or BRCA2. These are really important genes which all of us have, and we need it to work well. So they play a role. They're called tumor suppressor genes. So basically, they protect our cells. So if someone has a BRCA gene that is faulty, meaning it doesn't work, then the inherited risk becomes very high. If it's a female with a BRCA problem, then it's the risk of breast cancer and ovarian cancer. If it's male, and this is important, it's not just a female problem. Even though we are in the breast cancer month, if someone is male and has a faulty BRCA gene, then they might also get breast cancer. But they also have a much higher risk of prostate cancer. So what she did with that story was create a lot of awareness about inherited risk. So these genes are inherited, meaning we get our BRCA genes from either our father or our mother. And if it happened to have a genetic change that's made it faulty, then the person who was born with it would already have a high risk and compared to everybody else in the population for breast and ovarian cancer in females. So in Malaysia, there has been some studies, and if we had all breast cancer patients tested, about 6 to 7% of breast cancer patients would carry this faulty gene, but the percentage will increase. If someone has young breast cancer, for example, or if they have a certain type of breast cancer we know as triple negative breast cancer, or if there's a strong family history, meaning there are other members of the family with breast cancer or ovarian cancer or prostate cancer or pancreatic cancers, then the chances of being a carrier or having inherited this BRCA faulty gene then becomes much higher.
So in a cancer patient, you say about 5 to 7%. But what about a normal population? Has anyone gone for normal testing, like the healthy individual, and found out that they have BRCA genes? What are the percentage in Malaysia?
Yeah, so it is thought that 1 out of 500 persons would have this faulty gene. So it's not a very high chance, but it is not small either.
Sure.
Our friends in Singapore recently have, sequenced quite a lot of their population, and it is supposed to be high that. So, 1 in 500 or higher than that. So if anyone that has got that is well, that has no history of cancer or any of this family history, then it is about a 1 in 500 chance of being carrier.
Okay, and how do someone get this BRCA testing done? And is it expensive?
So genetic test overall just means taking a gene from either your saliva or blood sample and basically reading all of the components of the gene. So what we call the base test or the letters in the gene. So it's almost like a spell check. So when the genetic test finds a particular variant or genetic change, then there are certain ways to predict the outcome of this genetic change. So if that genetic change has caused the gene to stop working, then we are able to estimate the risk based on this gene. And different genes, when it's faulty, will have different risks. So to do this sort of inherited genetic test is either for a blood sample or a saliva sample. The price to do these tests in Malaysia right now is a lot cheaper from 10 years ago, or it's a lot cheaper even from when Angelina Jolie did her story. So it used to be 4,000 to 5,000 ringgit. Now you can do the test between 2,000 to 3,000 ringgit. That is the average. And sometimes those who want to do tests a bit more, then it might be a little bit more, 3,500, 4,000 ringgit. But about 2,000 to 3,000 ringgit is the cost of the kit.
So you do this test as part of a risk stratification for a normal individual, whereas I do the test mainly for treatment decision, because there are some breast cancer who have this BRCA genes, and they go for certain drugs for it, right? So in both these tests, we can use the same method.
So the technology will be the same, but the reporting also will be the same in the instance for breast cancer, because even if it's for treatment or whether it's to find out if there's an inherited risk, it is the same genes that are being tested, BRCA1 and BRCA2, okay. And it will be also from the same source, whether it's a blood or saliva sample. So the report will more or less be the same. But to interpret it, so whether it is directly relevant to a treatment choice for the drugs, that will be the oncologist that will really be talking about it. But working with the individual, so let's say if it's breast cancer patient, and when they have recovered, they need to be very careful for the possibility of ovarian cancer or the testing for their family members, because don't forget these are inherited, which means family members may also have inherited the same genetic change and they will be at risk. So the genetic counselors like myself will talk to the family members as well and guide them through the testing for themselves and what they can do in terms of the risk management process, or how they can screen, reduce their risk, or prevent certain cancers.
So is there this niche group of patients where they go for this BRCA testing, or anyone shouldn't just go for BRCA testing?
Okay, so all genetic testing will come down to why you're doing it in the first place. So we know that for patients themselves, meaning if they already have cancer, they are doing the test either to choose their treatment so that it can be more accurate, and that's where precision medicine comes in and targeted therapy. Then for these patients, their family members, it becomes very important. They are well, they are individuals who may have high risk because they are all from the same family. So these are the group that should definitely look at genetic parenting. Then you have the average population who probably may not have the high risk in the sense that they don't have a strong family history, but they are still worried about their risk. So they would need to be counseled so that they understand what the genetic information can give them. And also, it doesn't mean that they don't have to do it, but they need to understand what is the outcome of the genetic test report that they are going to have. So most tests now don't only just do these two very well-known genes, so they may cover a lot of other genes. In fact, some people want to test all of their genes, but to be honest, we probably only know less than 10% of our genes and what it actually means. So you test all of the genes, you might end up with information that you don't know how to use or might frighten you more. So it's always important to, before doing a genetic test, to understand why you're doing it in the first place and what are you going to do with the results. So very clear for the patients and their family members. We highly advocate to consider genetic testing if necessary, because it will really help to guide the treatment, but also it will really help to understand the risk better in family members, and prevention is very important.
Okay, so one final question I have is, if someone is a normal patient, I mean, they're not patient, they're a normal person, but they're diagnosed to have this, they are BRCA carrier. What are the implications if they know that they're actually BRCA positive?
Yes, psychologically. So imagine if suddenly you find out that you have this risk, lifelong risk. How is it going to impact you psychologically? How are you going to feel? Is it going to cause you more stress, right? And you can't give back knowledge, meaning if you know already, you can say, actually, I regret, I don't want to know it, right? So the decision is to come before you do the test. So one is the psychological impact. But the other thing also is, in Malaysia, we actually have very clear laws at the moment about the use of genetic information. We have very good Personal Data Protection Act. But just be careful in the sense that, if you're worried about whether it's going to impact in your future applications for, insurance and so on, do have to think about that first before jumping straight into a genetic test.
Okay, so do you have anything final to say to our viewers about a normal population and BRCA testing?
Okay, so for normal individuals, that means, they're healthy, always remember that most cancers are actually not inherited. So you already have a risk like everybody else. But if you happen to have family members who have cancer, then do think about whether genetic testing is useful for you to understand your risk better. And if you are pursuing a genetic test for your own health management, then do seek the right information from your healthcare providers. A lot better than doing something online without actual support in terms of understanding the genetic information.
Okay, so I just want to ask one last question. What do you think of the genetic testing test which you can buy? Is it really reliable?
Okay, so in a sense, the cost of doing genetic testing is going down because the technology itself is getting better and better, so it's cheaper. So people think that, if they just buy the machine, they can come up with a genetic test report. So the problem with a lot of these direct-to-consumer genetic testing, as we call it, that means you can just buy, order your kit from the internet. And you're not quite sure how the test is done and what is the coverage of the genes. So you having a good, beautiful report doesn't mean you don't have any risk. So be very careful with what sort of report. Vice versa, if you find something that says you are very high risk, don't automatically assume that you are going to be high risk. So all of these need to be verified in an actual diagnostic genetic.
Okay, I agree with you on that. Okay, so thank you so much, Suki, for being here in our show today.
You're very welcome. Thank you, Pastor.
Hope to see you soon.
See you.
The Bald Oncologist podcast series